And for more, we want to bring in Dr. Eric Braverman. He's a co-founder of Path Medical here in New York. Doctor, thank you so much for joining us. These are really unprecedented steps that the city is taking to stop these pockets of outbreaks from turning into an outright epidemic. And we've seen so many cases crop up already. But what do you say to the parents out there who, despite the warnings, despite the fines and penalties, still refuse?
Well, some of the most devoted people to God in terms of feeling find it sometimes hard to advance with technology, but they have to realize we're all a brotherhood, a neighborhood, where we are all responsible for one another, and you can spread measles to kids that are not religious, and we have to look out for one another. So the vaccine is really so successful. You had almost measles dead, now you got this almost 300 cases. And you're going to have 100,000 cases or deaths around the world. So you have a chance to set an example here in New York, which has a lot of measles relative to the rest of the country. There's about 500 cases around the country. And we really do need to get the kids vaccinated and be an example for everyone else.
How difficult is it to address a measles outbreak once it gets going?
You know, the heartbreak is that kids have measles and they show nothing for 4 days. So it's really a sad thing because now once it gets rolling, it can pick up steam, and so public health officials are going to be frightened that that's going to pick up and spread, and then there's a disease load concept. Once people start getting sick from measles, they get other things, it brings the immune system down, it's stressful on the parents, there are a lot of pregnant mothers in the Orthodox community. It really adds up to kind of a roller coaster, a spiral of pain and suffering that's unnecessary.
I'm glad you mentioned the immune system here, because we've heard reports in recent days of anti-vaxxers who've gone as far as to hold measles parties to purposely expose their kids to the measles in hopes that they will build up an immunity. What do you say to parents who do this?
I say to parents that the science is overwhelming. You can look at the graphs that once the measles vaccine became part of America, 400,000 cases a year went to basically zero. And that we have an entire world that has disease burden from Ebola to HIV, and that we all need to come together and look at the facts and realize that vaccination is almost as holy as circumcision, which is the covenant. And so George Washington started vaccination with smallpox. We need to realize this is one of the greatest breakthroughs in the history of medicine. That doesn't mean that we shouldn't also pay attention to hygiene. Cod liver oil is thought everywhere around the world in some kind of shot of vitamin A or pill to help. Fruits and vegetables help. The kids are all, basically next to each other, spreading them out, getting them exercise, getting them fresh air. But they're about to hit Passover. They're all going to be hanging together, and they're not going to be eating endless amounts of fruits and vegetables. They're eating chocolate cake. So it's and all the other things. So it's really important to get those vaccines before Passover.
This outbreak started last fall. Do you think the city has reacted in an appropriate manner when it comes to the timeline?
The city is in a challenging place because anytime you mandate public health breakthroughs, it can be hard on people. So I think the city has been very generous in waiting, and now the facts are obvious that these communities are at high risk, and Orthodox communities have to realize that they're also part of the brotherhood and sisterhood of humanity. And it's called Tikkun Olam, where you care about everyone in the world. So we want them to get vaccinated and feel good about it.
Dr. Eric Braverman, thank you so much for being here.
Thanks.